We're going to have two speakers next who are going to address an issue that was brought up a little bit earlier about there are healthcare workforce diversity and sort of harnessing the things that we have from people who are coming from other countries. So as we know, we have a lot of health professionals who have studied elsewhere, and the question is, well, how can we utilize this resource to provide healthcare that's culturally competent and addresses the needs of our immigrant community. So first we'll have Sonia Mora, who is the Senior Manager of the Latino Health Initiative and the Director of the Suburban, Maryland Welcome Back Center at the Montgomery County, Maryland Department of Health and Human Services. She is co-chair of the Health Committee for the Governor's Mission on Hispanic Affairs. And for the last 25 years, Sonia has been a leader working with immigrant populations, promoting engagement, empowerment, and health promotion. Today, she'll tell us about the Welcome Back Initiative, a program that harnesses the strength of immigrant communities by helping health professionals trained in other countries transition into careers in health here in the United States. This program has been recognized at the national level by multiple awards, including a very prestigious award by the Migration Policy Institute. And then after that, we'll have Luis Borunda, who is Maryland's Deputy Secretary of State and founder of the U.S. Hispanic Youth Entrepreneur Education, or USHE. Mr. Borunda has had a really long and distinguished career in business and public service. He served as Deputy Secretary of Health as a Deputy Secretary of State under Governor Ehrlich, and now again under Governor Hogan. And as I said, he has been involved in many business and education initiatives in the state, and established USHE, which is a program to help high school students, Latino high school students, transition into college. He's been an important partner for Centro SOL and our high school program. So we'll have, after Sonia Mora, Luis will talk to us about the economic benefits of diversifying the workforce, particularly in healthcare.
Buenas tardes. Oh, that's powerful. Our mics in Montgomery County don't work that well. We were just at a session yesterday and it was troublesome. So good afternoon, everybody. It is a pleasure for me to be here this afternoon. I want to thank Hopkins for inviting us to come and talk about one of the most exciting projects that I've been involved with in the past 20 years or so that I've been in practice as a public health practitioner. So what I'm going to be talking about today is actually the diversification of workforce by utilizing foreign trained or internationally trained health professionals and reinserting them into the healthcare workforce here in the United States. So let me just give you a little bit of background on why we're doing some of this. There's basically a few factors that converged to make us think about the incorporation of foreign trained health professionals. Number one, you all know this very well, is that our population is aging, and with that, our healthcare providers are aging as well. There is a lack of capacity from educational institutions to train the number of healthcare providers that are needed to actually meet the demand for all this increase in the population. There is an influx of cultural and language diversity. Earlier today, we heard a colleague from Montgomery County talking about the diversity in our county. And one of the pieces is that a third of the population in Montgomery County is foreign-born. So it's quite a diverse community. And then the implementation of the Affordable Care Act is really demanding that we have more primary care professionals. And so, like I said, it is difficult to meet that demand. The other part that we know is that in the state of Maryland and across the nation, we have a cadre of individuals who are very well trained. These could be doctors, nurses, psychologists, it could be engineers, it could be a number of professionals who are here in this country and who are not really utilizing their talents. They're unemployed, they're doing professions that are outside their training. And so, as you all know doctors that are driving cabs. We had a surgeon that is picking boxes at UPS, and we have nurses that are currently providing childcare. So this is, in our view, a waste of talent of people who have already been trained but are not being utilized. And we all know that workforce diversity may lead to improved public health. So when we started talking about how we could work with this cadre of internationally trained health professionals, one of the first things that we did was do some assessments and talk about what are the difficulties that they're having for reinsertion into their fields here in the United States. So one of the issues is limited English proficiency, and this is particularly true for Latinos that are coming from Latin America and are having a tough time learning the language. There is unfamiliarity with the licensure process. It's for different professions. You would imagine that it would be easy to understand how to, coming from overseas, you could be credentialed and then pass boards. It is amazing how you can't really find that information. It takes a long time and effort to navigate that kind of system. Obviously, if these people are not working in the field that is comparable to their skills, they are having economic difficulties. They're not making a good living. And that really is a barrier for them to go and get certification, take English classes, even take their boards. Because they're working so hard, then they don't have the time to study and prepare for boards. They're studying and working at the same time, taking care of their children. So that's a big barrier as well. And once you've been out of your profession, you've been a nurse, you've been in this country for 10 years or more, and you haven't really practice your profession, then you start losing your personal confidence and ability that you are going to be able to make it here. And the other piece that I think it's not just peculiar to internationally trained, but many of us, is the U.S. healthcare system and how it works. It's pretty complex. So what we did years ago was that we took all of these elements, and we also, in our research, look at different programs that are working with internationally trained health professionals across the country to be able to develop a model program. And we are lucky to have in Maryland 1 of 10 Welcome Back centers. So our Welcome Back Center is 1 of 10 centers across the country that utilizes a very similar model. We seek to diversify the health workforce, and we also address shortages. So it's not only focused on providing culturally and linguistically competent care, but it is addressing shortages. Recently, we had a huge nursing shortage, and we were able to support some of the efforts from our providers by bringing in some of our foreign trained. And so the process facilitates the integration of our internationally trained workforce professionals into the workforce. The model components, they're all really based on the needs that we discussed a few minutes ago. So some of the pieces is for individuals that come into our program, and I'm going to talk about who they are and some of their demographics. They will come into our program and they will be immediately assigned a case manager. So each person that is being served by us has an individual plan of action to move them through, whether it's certification, licensure, or whatever they need to be doing. We also provide social support and access to financial assistance. So we are able, for those individuals who qualify, to provide financial assistance for ESL, credential evaluation, for board preparation. A lot of things that you would not normally get support, they can get it through our program. We also have academic support. We talked about the need for learning English, so we have partnerships with the academic sector to be able to do this. We have refresher courses for nurses and others that have been out of the profession for quite a while and need to have those refreshers, and we do on-board exam preparation courses for these individuals. A critical component of what we're currently doing is the workforce development. So what happens if people finish? They get their certification, they get their licensure, and they have zero experience in the United States. Nobody's going to hire them. So we work with them to provide on-the-job practical exposure. We have some partners, And we have a new project that we're developing, a pilot, where it's the stepping stone jobs for behavioral health professionals. We help them with job readiness, skills development, and basically try to find a permanent employer. These are some of the partners that we work with. As you can see, most of them are based in Montgomery County. That's where the program started, but we do provide services for people outside the county. And I wanted to show you this slide. We haven't done any type of advertisement. Our center started very small in the year 2006, and without any type of advertisement, we have received calls from over 1,000 foreign trained health professionals who are seeking services. And this slide basically shows you the breakdown of their professions. Most of them are nurses, and then you can see the remainder of the professionals. What we're currently doing is we're serving, or we have been serving 214 foreign trained health professionals since we opened. And we opened with a very small pilot of 25 nurses, and we have been gradually increasing. We don't have capacity to serve. You saw 1,000 people. We've been able to provide services to around 214. And we have the breakdown over here of the nurses, the physicians that we have begun to work with, and very recently a pilot program that we received funding from Montgomery County and the Maryland Department of Labor Licensure and Regulations. If you look at the demographics of the people that we're serving, it's pretty diverse, as you can see, but about half of the professionals that we're currently serving are coming from Latin America and the Caribbean, but we have people coming from different corners of the world. This is a breakdown of the countries from Latin America. I know this is a Latino conference, so we wanted to provide you a little information of where our participants are coming from in Latin America. Most of our participants are female. And then we look at the professions. As I was showing you before, the bulk of them are nurses, then followed by behavioral health professionals, and then physicians. Physicians is an area that we haven't really begun to work with very extensively. And these are the demographics of the Latino community that we're serving right now. It's pretty similar. Now, what I want to emphasize with this is that these professionals are highly qualified. Out of this group that we're serving, 54% of the participants have more than 4 years of study or an equivalent to a bachelor's degree or above. And when we talk about work experience, 57% of the participants have more than 6 years of work experience abroad. These are not people who recently graduated. These are people who have tremendous experience. We have had individuals who have worked in huge hospitals in Latin America, served as administrators. They have had a lot of experience. So when they come in and they are hired by these employers, these are not newly graduates. They're really people who have a tremendous amount of experience. The bulk of the people that we're serving is Montgomery County. This is where we started the program, and this is actually where we have been able to secure most of the resources, but we have been able to serve individuals for other counties. A big area where we would like to expand is actually Prince George's County, which has a very large, also foreign-born population. Some selected outcomes. This is a very important one, and this is regarding increase in wages. So when you're working in workforce development, it's a little bit different than public health, right? And we had to learn a lot about workforce development. What really counts in workforce development is how many jobs did you secure, and did you make a change in the wages of these individuals? And as you can see, for the 163 nurses that we have had 166% change in wages. That means that when people came into our program, they were making around $11 an hour. And once they complete the program, they're making close to $30 an hour. That's a tremendous change. That means that they get immediately into a different tax bracket. That means that they're able to buy houses. That means that their whole life situation changes for them and for their families. We have had 113 different licensures, including 55 registered nurses that are currently working in hospitals, mainly in Maryland, but also a couple in Baltimore. We have had a 94% retention rate. That's extremely high. Most workforce programs have about 50% retention rate. And this is the specifics regarding Latinos. The Latino community has had even a little bit higher change in the wages, as you can see over here. Achievements is basically, yes, we have gotten some nice awards, and we're not going to brag too much about it. You can see it over here. But what I want to talk about are some of the contributions that we have made. It is a cost-effective model. A few years ago, we learned that in Annapolis, the Legislative Office of Affairs was going to cut our program. The little money we were getting from the state was going to get cut. It was around $100,000 at that time. And what the Department of Labor did was actually they looked at the investment that they were making out of those $100,000 and looked at the increase in the wages and what that represented in terms of taxes being paid, and they concluded that the program was pretty much paying itself. The other piece is that if you look at putting a nurse through a 2-year program, only a 2-year program at Montgomery College, it's going to cost about $15,000 per nurse to get that done. If you bring a nurse from overseas, the cost is around $45,000 per nurse. It cost us around $3,200 in training costs to get one of our nurses through the process. So that's why we talk about it being cost effective. It builds on the assets of the population, and that's so important because we're always talking about the needs and the deficiencies and how the population, it's always needing something. We are taking this, building on the assets of the community, building on their experience, building on the fact that they're here, that they're not going anywhere, that they're committed to staying in the United States, that they're grateful for those employers who hire them and they're loyal, and that's an asset. We don't need to start bringing people from overseas and doing, brainwashing from other countries. These individuals are actually here and they're here to stay. We address workforce shortages, obviously. In Montgomery County, we have had all these nurses that are now working, and like I said, a couple are here in Baltimore. Obviously, the issue of economic self-sufficiency, they're making better wages. It supports the integration of highly skilled and improves health outcomes, particularly among the diverse populations, among Latinos, among internationally, people who have come from other parts of the world, because then we have a workforce that is bilingual, bicultural. And who benefits is not just the foreign trained, or not the foreign trained, but the foreigners, if you will, or the minority groups. Everybody benefits. I'm going to close with a quick story of one of our nurses. This is the recently pilot that we brought in. It's 25 participants on behavioral health. But basically, this is a story of one of our nurses who comes from Guatemala. She had been working there. She was a top nurse in her hospital. Came to a program after like 7 years of trying to navigate the system, trying to get in, get her credentials done. She had pretty much lost hope. So she was one of the nurses in our original pilot. She had a lot of difficulty making it through the program because it's not easy. She had about 3 kids, a spouse that was not very supportive of her doing this. And what we did is whatever we needed to do, we got her counseling, we got her all the financial assistance that we could do, and we were there hanging with her. She completed the program. She's currently working at one of the biggest hospitals in Montgomery County, and we were told she's the best nurse that they have ever hired. One day, this woman was driving to work. She was going to the hospital, driving on Georgia Avenue, and as she was driving, there was an accident on the road. And there was this little kid, 2 years old, who had been hit by a car, was in this accident, and was having a lot of trouble breathing. So she got out of her car. She had her license then, and she said, "I'm a nurse." She administered CPR to this kid while the emergency personnel came in, and she basically saved the life for this child. So she was highlighted, and I don't have the article here, but she was highlighted in one of the Latino newspapers as a heroine. because she saved the life of this child. And, you know, it wasn't a Latino child. It was just, she said, I'm a nurse. I like to work with people. I like to, you know, provide a hand, and this is an opportunity for me to do so. And like that story, we have a few. So I'm very proud of the group that we help, and what I want to reiterate is that I always tell people this is not rocket science. This is just trying to work with your community, finding out what they need, and making it happen to them. This is not about doing any special favors to anybody. All of these nurses and all of these personnel are actually going to be taking the boards that anybody who is trained in the United States is going to take. It's not lowering in standards, it's just contributing. So I think, again, it's a program that looks at the assets, and I think that's why we've been recognized for it. But the biggest satisfaction for us is not, you know, that I do the work, is when you come and you see these individuals now working in the hospitals and in community clinics and schools, actually performing the work that they work so hard and that they train so hard to do. So that's it. That's the story.
I assume that the person that applies to this has to have a legal status?
People understand that if they want to work in this country, they need to have some kind of status. We do not ask because we're not the employers. So we don't request, we don't ask for immigration status from our participants. What I can tell you is that some of the individuals who had difficulties when they entered the program because they didn't have legal status were able to resolve their issues, and by the time they're done, they can apply for a job, but we don't ask for that information.
And how long does the whole program?
It varies.
Like from the person?
It varies because it depends on where people come, right? If their English level is high enough, if they'd already done their credentials. So this is not like a class that people go and follow. Actually, there's not even a lot of classroom work. Most of the people that come already get their credentials evaluated. We had, out of these nurses that you saw, only one needed one course at a university to be able to have her degree validated here. So it varies, but it's around 18 months for the nurses. We will see for the behavioral health professionals. We know that probably is going to take longer. The MDs is a whole different story. Only about 10% of medical doctors that are foreign trained in this country can go back to their profession of origin. It's really hard. However, they are the ones out of all the groups that have most possibilities because they can reinsert in other capacities.
And what other professions do you guys help, like outside of the health?
That's it. We're really focused on health right now. There are other programs across the country that are helping other professionals, but we focus exclusively on health professionals.